They are the first line of defence in the health system, but for an ageing population with more complex needs, the demand for GPs is increasing. The problem, though, is that the numbers in their workforce aren't. It means patients like Jamie, who suffered unexpected significant weight loss, was unable to get an appointment despite calling his GP more than 200 times.
When they ask you what's wrong and you tell them, you know, you still can't jump that queue.
And how did you feel when you were waiting so long to get an appointment?
So it's frustration, it's anger, and it's madness. We're supposed to be having all these nurses and doctors. Well, clearly we ain't got remorse. People like me won't be waiting weeks for appointments.
According to a study by the Health Foundation, England is currently short of more than 4,000 full-time GPs. This is set to rise to more than 10,000 in the next 8 years. Under a worst-case scenario, it suggests up to half of posts could be vacant, and the projected shortfall could rise to more than 20,000. But patients are already struggling to be seen.
Doesn't seem to be anything on here.
The government says part of the problem is a COVID backlog. Doctors, though, warn the problems existed long before the pandemic.
We've got an issue with recruitment and retainment in primary care. Okay, so we didn't have enough GPs to begin with, and we won't have enough GPs moving forward.
The government, though, has promised to hire 6,000 more GPs in the next 2 years. A recruitment drive, the Health Secretary says, is working.
We're seeing GP numbers rise by more than 2,000 since we made a commitment to raise numbers. So we're seeing more GPs, we're seeing more primary care professionals.
But doctors say they're just feeling more pressure, and health experts warn that recruitment target is unrealistic, worried the health system may never catch up. Sangeeta Lal, ITV News, Barnsley.